Welcome everyone, and thank you so much for joining our webinar today, talking about Healthcare's Shared Interest Group for Social Workers. So wait for everybody to log in and have the chance to, get their audio set up and be able to hear. Just so all attendees know, all attendee phone lines are muted and will be muted for the duration of the program. So don't worry if you have any background noise going on, we won't be able to hear it. You will be able to chat and ask questions in both the chat box and the Q&A box. Please try to keep questions over to the Q&A box just so we can sift through it a little bit easier. There are hundreds of people who were registered for this webinar today, so we may not be able to get to all of the comments or questions, but we sure will try. And there may be moments where we're even able to bring people on, and if that's the case, you can just raise your hand and we'll give you the opportunity to unmute yourself and speak. So for everyone who's just joined us, just to let you all know again that all of your phone lines are muted and that you can put comments or questions in the chat and Q&A. And with that, I'm going to turn it over to Tracy Grafton, Stephanie DePiano, and of course our Executive Director, Jennifer Thompson.
Tracy, who has just lost video.
We can see you, Tracy.
We can see you.
You can see me?
Yeah, you might have it minimized.
Yeah.
Oh.
Well, welcome, Tracy and Stephanie. We really appreciate that you're able to join us today. This has been a conversation we have wanted to create space for. We know that there are so many healthcare social workers on the front lines, continuing to show up every day in hospital settings and just a variety of settings and continuing to do the important work. And we wanted to make sure that the community had a space to come together and ask questions and dialogue and share challenges that they're having and talk about resources as well. So I am excited that you're here and so grateful for your participation. I'm going to turn it over to you and we'll get the conversation started. So thank you and welcome.
Sounds good. Well, we want to thank you for doing this and hosting this. We are excited to talk with everybody and to share what we have been doing, what our knowledge base is, and to gain any additional knowledge that everybody else has to share with questions and keeping the dialogue running. So we're hoping for a lot of questions so we can really interact. I'm going to hand it off to Tracy and I'm going to let her kind of start and then keep those questions starting.
Well, good afternoon and thanks again for hosting us. Thanks to NASW for reaching out. A couple of weeks ago, I was approached by NASW and I was so touched that I knew I had this network of my people, especially during a time like this. I was reminded of 9/11. I was a brand new social worker then, and I didn't really know that all of this was even out there. And I think it's awesome that we can come together in this way to share, at a time when we're being asked to really step up our game and be so on point, at the same time that we're dealing with this personally, at home. And it's just good that we have each other. I had a colleague, I don't want to mention names, but a colleague who reached out to me and said, she was in tears. She said, I'm pregnant. I have a toddler. She said, I have to work because I'm an ICU counselor. I'm having to do things different than I've ever had to do before, talk to people through the glass, on the phone, talk to their families distantly. And she said, I'm being asked to provide support to all the staff here. And she said, I just feel like nobody's really there for me. Nobody's looking out for me. And I told her, I know who's looking out for us. And I'd be surprised if she weren't on this call today. So thank you, Jen. Thank you, Helen, the whole team for hosting this and giving us this opportunity.
You're so welcome. I hope that whomever this is, they're on the call as well, because we want to create a community for support that's absolutely needed.
So Stephanie and I were thinking about how do you even begin to frame this? It's so atypical. It's COVID and our changing world as we speak. That we're all being asked to step out of our comfort zone. We're having to remember the basics of what what we know to do, having to flex beyond what we would have thought a month ago would be normal, and we're having to learn new skills. And we just really thought the importance of consulting with our colleagues, and this is really important to be able to have time for self-reflection and new skill development, so we can be the best to ourselves, the best to each other, and the best to the communities that we serve.
So many of us who are in healthcare only kind of tend to have a certain population or a certain area where we are focused, because that's what our agency requires. That's what the bigger scope of the community requires in many aspects. And I think what's happening now with COVID is that everybody is kind of an all hands on deck approach to talking about things and addressing things that they have never had to do before. And I think it's really scary for us as social workers when we have not had to talk to a family member whose loved one is dying in the ICU, or when we have, had to talk to our dialysis patient who is now a COVID positive patient. So we really kind of want to have some dialogue about some of the things that you guys are struggling with, some of the things that, might be new to you. We have a lot of tips and tools that we're going to send out to you after this webinar is over, and we were going to talk about some of them briefly, but we really want to hear from you guys too. What are some of the things that you're struggling with? I know for me as a palliative care clinician, I talk about goals of care and I talk of end of life planning and the struggles for that on an everyday basis. My job is even tenfold more difficult because of this new crisis. So I can only imagine how difficult it would be for a social worker who's not comfortable talking about this to now potentially have to be answering questions from family members. Well, what does this mean? What am I supposed to do? What if I have it and I give it to my loved one? So I think there's a lot of things that are out there now that are kind of everybody's learning as we go along and pulling from different resources that are available and kind of doing what we can the best we can.
I'm looking at some of the things that are popping up, and it's like ping, 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 of things that, of course, in your own little myopic world, you don't even think of the multi layers of the challenges. One of them being the lack of resources, because as social workers, we depend on our knowledge of resources, right? And it's like, oh, that's not available anymore. Oh, that's now gone. It's like societal infrastructure has just completely changed overnight, and we're having to try to stay in the moment. What's the latest today that we can figure out? Really having to kind of anticipate, stay ahead of the game. I'm looking at people looking for support with how do you get your COVID patients to dialysis? I mean, like, who would be thinking of these things? Yeah.
And I think, I would like to address that. I just wanted to touch on the first question I'm seeing here about depression amongst my dialysis patients. And I think the depression and anxiety that we are going to be seeing is at a heightened state for something that we've probably never seen or experienced before. And we have to remember that we have skills that we have always used to address depression and anxiety and fear. And I think we have to remind ourselves of what those things are. And we also have to be very mindful of the fact that we can't change a lot of these circumstances. I know as social workers, we want to help. We want to be the helper to help fix the situation. The reality of our situation right now is that a lot of these things that we're dealing with cannot be fixed. And they are going to result in a likely not great outcome for many people. So for dealing with the depression, I think it's really important to remind yourself and to be a presence. The power of your presence and your time cannot be understated when it comes to this crisis. I'm working from home right now telephonically. And initially I was concerned that I'm not going to have the same kind of impact on my patients, and we're not going to be able to have that same kind of relationship and that give and take. And I am not finding that to be accurate at all. Just the fact that we're on the phone, we're having, whether it's telehealth, via phone, whatever it is, the fact that I'm there and I'm listening and I'm crying with them sometimes because of the situation is just so difficult on everybody. And being present in the moment with them is really one of the best things you can do. Of course, you're going to call on all of your skills that you know, but don't minimize just that contact, that one-on-one, that personal contact that you are giving, because so many people are being lost in this system right now because there's just no time. Everybody is, running and doing and trying to put out fires. So I think our role can be that role of, I'm here, I'm with you, I'm present. How can I help you? And if I can't help you, I'm going to be here and I'm going to support you and I'm going to listen to you. I'm going to do whatever I can possibly do.
Yeah. I think that for many of us, those feelings of helplessness are palpable, right? More so than ever. The kinds of stuff that I'm seeing in the acute care setting is stuff 20 years of hospice work never prepared me for. Right before we started this webinar today, I was on the phone with yet another woman who is dealing with her mom being at home on hospice because of COVID. She herself is sick. Her daughter is sick and recovering, and her husband's here dying in the hospital. And she's having to make difficult decisions without seeing him, without really being able to talk and dialogue. And this bomb just dropped in their lap 2 weeks ago. Before that, they were just your average family. And I think, what Stephanie, I can't reinforce enough, hearing you say that as my supervisor last week and hearing you say it again today is tremendously helpful to be just re-grounded in checking in on what is my responsibility in all of this, and what can I bring to this. I can and I will, but also just being mindful. And I think that's something that we definitely wanted to address today too, was that whole thing about, as social workers, the self-care aspect amidst a national or international crisis that we are waking up to every day.
There's a lot of questions, so I'm going to try to grab some that I can see and answer.
Oh, there we go.
Stephanie, I can read them off for you if that would be helpful.
That would be amazing. Thank you.
I know it's a little hard to keep up with the chat box. Just for everyone, I wanted to make note of three things really quickly. One, we had a couple of chats come through about your children and making appearances, and that's completely okay here. I've seen us 5 minutes ago. My son was dressed up as Deadpool and during camera space. So if your children are there and in the background when we bring you online, don't worry about it. We understand that you're home. Secondly, there's a chat box on the side. There's an opportunity to chat with all panelists or all panelists and attendees. So if you want to have a conversation with everyone in the community, which we certainly welcome you to do, just change down before you type your response and click send to all panelists and attendees, and you can have a running dialogue there. As well. And I think that's sometimes just beneficial to share ideas and resources with one another. The number of questions that are coming through, I'm going to start with a couple of the first ones. And the idea about survivor's guilt in terms of allowed to work from home in a safe environment, while some of our colleagues are continuing to be on the front lines, risking their health and a little bit of guilt about what that looks like for us as social workers who are in our homes now.
That's a great question. And it's one that I think, I've struggled with as a manager because I do have social workers in the hospitals who are still out there, working. We're not seeing patients hand on or anything, but they're still in that environment. And it's a really good question because I think it's very true. And to acknowledge it, I actually had a conversation with my director about the fact that I would want to go in to do and to just be with them. And the reality is we are a limited workforce. I think if we can preserve the health and well-being of as many people as possible, that's our goal. And the people who are on the front lines are there, and they're willing and they're able and they want to be there. And God forbid they should get sick or something should happen and they can't be there. We'll be there. So I think we have to look at it from a huge system level and know that just because we are not there does not mean we're not there for them. We're not there for our patients. We're just not in that environment. So it's real. There's not a simple answer to it, but I think those are some of the things that you want to just think about, and you want to be in contact with them. You want to be in contact with your colleagues. You want to reach out and say, hey, I'm here. Can I help you? What can I do from where I am? Just to let them know that you are still there for them, I think is really, really important.
Stephanie, I think that's so important. I think a lot of us who are at home, and as social workers, we tend to be like, let's rush in. Where can I be? How can I help? I want to be on the front line.
We're the fire people.
Yeah, we are. And I have this conversation in my own household of like, I feel like I should run and go and be there.
Yeah.
And my family has to say, no, then you're just contributing to the problem, right?
Exactly.
So, giving ourselves a little grace in that as well, to say like, there is guilt. It is hard, but we probably are doing the best that we can by staying home and protecting ourselves and not putting other pressures on the system.
Absolutely.
And you're right, and being available.
And the needed resources. Like, we send somebody into the hospital who's not going to be able to see a patient or talk to a family face to face, but they have to gown up and wear everything. Well, we're wasting resources that those bedside staff members need. So we can do that from a different environment and keep everybody safe, and preserve that needed PPE.
I just to kind of cap that off, I think we often confuse action with the right thing to do. And I think as social workers, we know as good as anybody that actually sometimes the right thing to do is to show restraint and to sit on your hands and to pull back and, like, for example, allow room for silence. This is one of those situations where it's really, we have to be the models for how to be effective in alternative ways, not just to be drawn to the illusion that somehow doing something is going to alter all of this. It doesn't necessarily. And there's other creative ways that we can help. If you can't be on the front line and contributing, in a very physical, integral way, that there's a lot of community behind the scenes things that you could do to lift and support those, all the other people that are out there. Even if you're not at work, in your own community, there's got to be needs. So it isn't like you have to be completely, ineffective.
Yeah, so true. A couple of other questions have come through along the same sort of theme, but just the idea of social workers being or struggling with the idea that they are essential and needing to go into work and struggling with bringing that home to families and the fear around that. Thoughts on how we can help support our community who is very much so in the thick of things, because they have to be.
Yeah. Another amazing question. I think we are torn in many ways when it comes to, are we essential? In my view, we're essential for people's emotional, psychological, and mental health, 100%. Are we essential when it comes to hands-on care? No, we're absolutely not. And I completely understand and get and identify with those who cannot be home, those who have to go into the hospital, who might be discharge planning and working with those patients and those families. And the thing I can say is that what you're doing is tremendous. And I think you have to just find a balance between protecting yourself and your family and doing your role, doing your job. There's not an easy answer to this. I think it's really important to make sure you're speaking with your employers, your administrators, your leaders, and sharing what your concerns are, and asking them to brainstorm ideas. What's required of me now? What's not required of me now? What happens if I get sick? Then who does what I do? Those are all important questions to talk with your leaders about, because especially if you're in a small agency or a small place where there's only a few of you, what happens if by going in every day, three of you get sick? Now there's nobody to do what you're doing. So I think sometimes our employers also don't look at it from every perspective. So I think having a good dialogue with our leadership is really important during this time, to talk about what your concerns are, and bringing things home to your family. I will tell you, I'm a paranoid freak about having to go out to the grocery store. And if anybody comes home to my house, they have to change in the garage. They have to put on their robes and then go shower. I wash everything down. And that gives me comfort. That's what I'm doing to give me comfort that I'm okay, my family's okay, my pets are okay, that we're doing everything possible. And I think that's what we have to do. We have to find what's going to give us comfort in this situation. And that's what we do. It's not going to be easy, because we are, like always, when we have to work with the constraints of a larger organization, those are struggles that I think that we have had for a long time before COVID, but this is just adding to it. But, doing what you can do that's going to give you a feeling of safety and comfort, and speaking with your leadership, I think are some of the good places to start.
So I have to laugh because last weekend I pulled out our wills. And I was like, I'm always preaching to the choir, and I'm like, I think I need to kind of go back and pull out my own stuff. And it was really funny because I haven't actually looked at our wills since 1995. And I was reflecting on how much has happened in that time. It doesn't really address the question about are we essential, but I just wanted to kind of add on to what you were saying, Stephanie, about what we can do, how we're juggling this. All of a sudden, the social workers, we go from maybe not always feeling so valued or so essential, and all of a sudden, boom, overnight, you are very essential. And at the same time, you're also trying to attend to your own families and your personal needs. It's a lot to juggle.
Absolutely.
And I think today is already great in that it's a bit of like a support group, just a place to be able to verbalize a lot of the anxiety and the heartache and just the tremendous sadness and stress that we're all feeling. Yesterday, they had was it yesterday or 2 days? Yesterday it was. I had to lose track of time. They had a wonderful parade of the ambulances and all the paramedics and fire trucks come by the hospital to show their support. And I'll be honest with you, it was the first time since this all happened that I actually cried, because I was in a space where I wasn't having to act and think and do, and I could just feel for 5 minutes. And I was standing with a group of social workers outside, and I was like, did anybody think to bring tissues? One social worker had one tissue. So, but it's a very emotional time, and I just, we're having to think in our professional heads, but we're constantly feeling, and it's good to be checking in on how you're doing through your day, through your week, as we're going through this.
Yeah. I also wanted to acknowledge something that we hear quite a bit, and I'm sure people on the phone are struggling with, is the idea of the ambiguity around what does essential mean and how does that look and feel in not only each different healthcare setting, but also while one, let's say, dialysis center might be handling essential social workers in one way, you might be handling it differently. So we hear that some are being able to do their work, continue to do it from home, right? And another location might be requiring their essential social workers to be on site. And I hear that there's a lot of ambiguity in what does essential mean, and does essential mean that you have to be on site and not not a lot of clarity around who can be at home. I don't know that there's an answer to it, but I know that that's a struggle.
Yeah, and I don't know that there is a clear answer, Jen, but I do think we have to be our own advocates as well. And I think it's going back to the fact of talking to our leadership about what makes me essential in your eyes that requires me to be in this setting, rather than in a safe home setting where I can still do my job with my patients and my families. So I think we have to be our advocates, and we have to ask our leadership, what are you expecting of me? How am I essential to my dialysis unit right now in an in-person
Physical setting.
Yeah, physical setting. And just to touch on, I'm seeing this question keeps drawing my eye to the side about I'm a dialysis social worker, pregnant, and how do I balance my guilt with setting boundaries and and limiting face-to-face contact. So we are social workers, but we are human beings who are living in this crisis as well. And I think it is really important to identify that this is scary for not just our patients and the people we're working with, but for us.
Yeah.
I think we have to bring, ourselves to a level of I'm a person just like you are, with my fears and my concerns and my worries. I know we work to never put our own burdens on our patients. That's part of our ethics to not do that. And that's not what I'm asking. I'm asking to just be a human being in the same situation that your patients are in. And I think you can find a way to connect on a different level by doing that and saying, listen, I'm still here for you. We just can't see each other face to face because I need to protect myself and my baby and my family. And I don't want to bring this to you or to somebody else. For so many of us, the fear is that we're going to bring something home, but so many of our patients are so medically compromised that there's a very good chance that we could bring something to them.
Yeah.
So when we look at it from all of these different perspectives and we're able to say, hey, I'm in this with you. How can we protect each other? I think it gives a little bit more normalcy to what they're going through as well.
Yeah, I agree. A couple more questions coming through that I thought might be nice to transition to. The idea of feeling valued working from home. People often feel like they're more valuable in an office work than at home. And thoughts and tips, I know we've touched on it briefly, but thoughts on how do we, I don't know, just manage that feeling.
So, we're in a large health system. So we have hospitals, we have our home-based and ambulatory palliative care, we have nursing facilities. Our nursing facilities, they're being overrun, just like the hospitals are with patients. So from a telephone perspective, we're calling families, we're calling patients who are now COVID positive, and we are talking about their goals. Having these goals of care conversations, which we would normally do in a face-to-face setting, we are having them via phone. So we are working to establish a relationship with somebody in a very short window via telephone to have these kinds of conversations. So I think there's so much value in what we are doing when we're doing it from home. We are able to help a patient potentially not enter a hospital setting where it's not going to be beneficial for them. It may make them worse. It'll hospital system. We are keeping people in their own environment, which is we know they're most comfortable by just having an open dialogue with them. And we can do that via phone. So I think it's really easy for us to minimize, and not just us, but systems at large, to minimize work that's being done via phone. But the reality is we are having huge impacts on people by having a conversation with them over the phone. And we are having a huge impact on the system that's being so overrun and overburdened right now by having conversations with people on the phone. We're able to transition people to hospice. We're able to get appropriate medical intervention orders on their charts based on how they're doing. So there is so much that can be done via phone. And those patients that we have that are isolated at home alone, your phone call means
Yeah.
everything. You know that phrase that, one person maybe can't change the world, but you can change the world for one person? That's what you're doing. You are changing that person's world for that day, for that hour, for that week. Some people say that that's what I look forward to all week, is being to stay connected with you. So please, I beg of you, do not minimize your value just because you are not physically present with other colleagues or with a family member.
Yeah, I echo that. I also really push back on that notion that we're not being helpful by being at home, because I think right now that's what's required of us, right?
Absolutely.
We need to stay home. We're modeling what we should all be doing, only leaving if we have to, if it's essential. And one of the greatest things that we can do as social workers is model appropriate behavior.
Absolutely.
And so I know that it feels frustrating, and I feel frustrated too, and you're not in it alone, but I think we're doing more than we give ourselves credit for.
Absolutely.
Another question that's come in, and then I'm also going to invite everyone, if you have questions, to raise your hand. We'd love to hear and see from other people in the community. So if you want to raise your hand, we'll have Annie bring a couple people online in just a second to ask their questions live so we can hear from you. But in the meantime, there's a question that has come through. Being a hospice social worker, my greatest challenge is supporting spouses and children who cannot see or be with their loved ones, or dying in a facility or that's locked down. Any advice that you can give to counseling families to prevent complicated bereavement and grief?
I would love to say, yeah, we'll be able to prevent complicated bereavement, but I don't know that that's a true reality. I think we can do our best, just like we always do. There's a really great resource that we are sending out. It is from CAPC, which is the Center to Advance Palliative Care. And it talks about, there's a whole thing about saying goodbye via phone.
Yeah.
And how can we still make that impactful? How can we still make it a moment that we all should be able to have with our loved ones, even if it's not face to face? In the work I do, I often have talked to people who have said, I can't believe I wasn't there for their last breath, their dying moment. I can't believe I wasn't there. But the reality is that's not the most important moment in somebody's life. It's all the moments that existed prior with your relationship with that person. And drawing on that and talking about what your relationship is like, what would they want for you? What would your loved one want for you right now? They understand you can't be there. Nobody can be with each other. So calling on some of those skills of reframing how they're looking at this situation, I think can be very, very helpful. And those resources are really, really great. So I'm excited for you guys to have them and be able to look at them, because I do think it will help in your practice with your conversations. But we can still make those moments important and powerful, even if they're not face to face, and maybe facilitate that with your family members. Be there, call up on the phone, get a FaceTime call, or, do something. We're trying to do a lot of those types of things in our hospital settings when we have maybe somebody that's on inpatient hospice and the family can't be there all the time. And we're doing those FaceTime calls with iPads and things along those lines, so they can at least see each other and hear each other's voice.
I think there's been a lot of flexing and, adapting. My experience has been where there's a will, there's a way. Most people, I think, are holding on to the human aspect and finding ways to bend. And, it doesn't have to come from one person. A lot of people are, let's put our heads together. How can we, as long as the hearts are there to help make it happen and it's within reason, policies are being flexed too. So. Yeah. For the better and for the worse, unfortunately. But I think there's we are adaptable, and we're being forced to stretch out of our comfort zone, like really, really quickly and, on the spot, but we're doing it. And I think it's amazing to see a lot of creative ideas that are actually being born out of tragedy. that there's a positive reframe too, as I'm excited to see, when this is all over, and I've got to be able to say that when this is over, I'm excited to see what kinds of nuggets we were able to take from this and effect more change, because you just keep doing the things always the same way. It gets rote. You're doing because that's what you always do. It's not till something like this happens that you're forced out of that it does give you that opportunity. Nobody would ever ask for this, but it's what we can do with it to, hopefully put a positive on a very negative time in our lives.
I think
I would also just suggest, I'm sorry.
No, go ahead.
Especially if you're on hospice, you might want to call on your bereavement counselors who are used to doing the work after, after the person's loved one has died, and potentially see if they have any tools and tricks too for you that can help with the anticipatory grief of not being there with their loved one. That might be a good resource within your agency too. We collectively, within our team, we're collectively trying to come up with some ideas. We have our meeting scheduled tomorrow with all of our social workers, and we're trying to come up with ideas for how we can address that complicated grief that's currently present before that person has died, as well as after the fact. So I think, pulling in every resource, every person you have contact with to ask for suggestions is good.
Yeah, I think that's sort of the beauty, two things of our profession. One, we've always been innovators, right? We've always been the people who will look at a situation and try to find a solution to it. And I think right now we see that social workers in healthcare settings are getting really creative about ways that they can help families deal with loss and end of life via distance. And I can't even imagine, but I do hope that throughout this, we're thinking about what are the great nuggets that we can take, right? What did we learn from this? How do we create space to perfect some of these things it is going to end, but there's also something else that will happen similarly. And how are we emerging better prepared and stronger, more agile and nimble? Maybe we'll have defined what essential means for the next go around. So I certainly, there's, I think a lot of good that hopefully will come out of this in terms of our professional response and resources. Wanted to open up the line. Annie, are there anybody with their hands raised that would like to ask a few questions?
Yeah, we have one person. It's V. Manuel. I'll allow you to talk. You should be able to unmute yourself. I think it's.
Hi.
Hi.
Thank you.
Can you just tell us what your name is and where you're calling from?
Sorry. Can you hear me?
Yep, I can hear you. Yeah.
Okay. Virginia Manuel. I'm a retired medical social worker. I just retired a little over a year ago from 43 years in social work. And about 20 to 25 of those years being in medical social work. And I'm still working with, not working, but I'm still volunteering with our state chapter office. I'm in Texas, I'm in Houston. Will Francis is our state chapter executive director. Anyway, so hi everybody. I hope you can't see me because I look terrible, but I'm retired, so Anyway, I've really enjoyed hearing what y'all are saying, but my concerns are really in a different way than what you all have been talking about. Y'all sound like y'all have up in New Jersey a lot of support from your supervisors, from your managers, from your departments, from your organizations for what you do as social workers. Unfortunately, in Texas and specifically in Houston, there is so much more, and has been for several years, so much more, what's the word I want, focus on case management, because the nurses became very strong in saying, well, we can do a lot of things that the social workers do. And they have inveigled themselves into our departments. And now, instead of being social work departments, we are clinical case management departments. That being the case, we then no longer had a director who was a social worker. We've had nurses who were social workers. Mm-hmm. And I am sorry to say right now, Bentob Hospital in Houston, which is our big county public hospital, our director is an MSW, but she doesn't want to be one. As a matter of fact, she was stupid enough to tell me when I was still working there that if she had to do it all over again, she would have gotten a degree in something else. So that kind of tells you her philosophy in dealing with the social workers in the department. So the concern that my former coworkers have, which they discuss with me, they call me and, you know, kind of vent to me, is now during this whole COVID thing, they are not being allowed to do anything from home, even though they might be calling the family because maybe the patient is unconscious or on a vent or whatever. They're not allowed to do that from home. They have to come into the hospital. And B, they are being forced to go up into the rooms rather than calling on the phone, which is stupid because, like y'all said before, why use the PPE unnecessarily? I mean, if you're doing a psychosocial assessment, quite frankly, you can do that on the phone. It's not optimal, but these are not optimal times.
Exactly.
So, you know, that's a real problem. The other thing that this director has suggested is that if this public hospital gets to the point where there are a lot of COVID patients, and there aren't right now, knock on wood, but if it gets to that point, first of all, they'll have the nurse case managers go up on the floor and help the regular nurses up there, which is fine. It's logical. They are nurses. But then she talked about, and we'll have the social workers go up there and do things like blood pressure. Excuse me, that is outside our scope of work, and they don't want to be legally liable for anything that happens. You know, this person is not really understanding that not only could the hospital be sued by a family because somebody who's inappropriate is doing certain things, but that person themselves, the social worker themselves, could be liable. So the social workers are getting very afraid, but they're also afraid of losing their jobs because this person has been very clear about not being supportive of the social workers' concerns. So I know that was a long statement, but in my area, that's the big concern. The other thing y'all were talking about, they feel like they're doing well. They're using their social work skills. They're supporting families. They're supporting the patients, but they are not being supported.
So those are really great questions and concerns. And, you know, we have our management departments they're functioning that way currently in our hospitals. So the nurses and the floors have been redeployed to work in hands-on care, and the social workers are doing most of the discharge planning, and they are actually working in the hospital. I would have a really hard time believing that the administration at that hospital would allow social workers to do blood pressures. And I think if it comes to that, those social workers really need to advocate for themselves and go above her and say, this is out of our scope. This is
as a group
comfortable with. And, you know, there's a point where, yes, I'm going to do everything possible to do my work, but I also need to be supported, and I'm not being it, and I'm asked to be doing things that are not in my scope of practice. And they need to find a way and find a contact that's above her to address those concerns. It's unfortunate. And from everything I'm hearing, they're concerned about Houston being the next big epicenter. So, you know, I'd be mindful of this and maybe start those conversations now with the people that are potentially above her in that role. And you know, you start with her, and if she's not willing to listen, you say, well, I need to speak to somebody who's going to listen.
And I think there's also this, those are all really great points. It's really frustrating to hear that social workers are being asked to practice outside of our scope of practice and knowledge area and expertise. I think the one thing I always encourage our social workers to do is advocate for themselves. And this is one of those areas where I think you have to push back to say, my licensure is on the line.
Absolutely.
I have a code of ethics, and my professional association, you know, NASW has really great guidelines around this type of abuse. I'm not sure if that's the right word, but you know, if we practice outside of our area of competency, we can be brought up on ethical violations. We can lose our license. We can suffer consequences. And I think that it's really important for us to sort of print out that and take it to people and say, here is what I do as a social worker.
Right.
Here's really clear where the boundaries are. Happy to help wherever I can, but some things just aren't my area. That was a great question. I'm so sorry to hear that that's happening.
I am too.
And I hope it doesn't come to this, but if it does, you know, the NASW, the national office, does offer legal support. Many years ago, I was being asked to take nursing students into dying patients' rooms with me to watch a social worker in practice, not learning nursing skills, task-oriented things. And there really was, I don't mind taking a social work intern with me, or even a colleague who is a professional already with me, but there didn't seem to be any value. I felt like I was being asked to really babysit, and it was inappropriate. It really wasn't about the patient's needs. It was about that nursing student's needs. So, and not even being able to ask the patient if it was okay. And administration wasn't really keen on hearing that. And I reached out to NASW in Washington and spoke with a person there. I got the actual written up policies on that, and it was very helpful. So just know that we're there for you.
Yeah, I would encourage everyone, if you're particularly in Texas, reach out to Will. I know him well. He's an incredible resource, but all of your state chapters are. If you call your NASW locally in whatever state that you're in, we'll be able to connect you with those national resources and our ethics teams. And we're definitely here to support you. Annie, are there other questions? Anyone else with their hand raised?
Yeah, we have Cindy. Cindy, I see you have your hand raised. I'm going to bring you up.
Welcome, Cindy. If you could tell us where you're from, that would be great.
Cindy should be able to unmute yourself. Perfect.
Can you guys hear me?
Yes.
We can. Hi, Cindy.
Hi. Thanks so much for taking the time to do this. So I have a kind of not too unique, but I'm in New Jersey. I do work for a hospital where I would say 90% of the patients are COVID at this point. I can kind of just give you an example. If our census was 311, I believe, 198 of those patients were positive, 76 were rule out, and 65 were on vents. So that's kind of our reality. I also work for home care, so I have a little bit of a double role there. So my question would be just seeking, I guess it would be support. You know, it's really hard to have these conversations, and they're not conversations that I haven't had in the past, but the volume of the conversations where coming off of one phone call, we in New Jersey, in our particular hospital, we are not doing inpatient, you know, we're not going into the rooms. We have phone calls, phone numbers for everyone, and if we can't reach the patient themselves, then we're reaching out to family members, especially if they're vented patients. So it's more of asking what suggestions you guys have on having that difference in the role where, you know, you've gone from support and discharge planning to 100% support. I can tell you, I worked and I walked out crying because it was just so overwhelming that, you know, creating these situations where unfortunately patients are now going into hospice and they're COVID positive, and trying to arrange for the family members to meet them in the parking lot before they go into this hospice inpatient, so that they could at least know that their family was there. And that is 100% of the day, and it's very overwhelming.
I'm giving you a virtual hug right now through the computer. You and everybody else who's dealing with the level of complexity and intense emotions that you're dealing with on a day-to-day basis. I can share with you that I worked in hospice for 20 years, and I'm only new in the acute care setting in a palliative care role. And I share the sort of the trauma, so to speak, that you're talking about. Like before 2-3 weeks ago, if I had 1 or 2 really intense, hard conversations on a given day, you know those ones, they stand apart from the others. And I would walk out thinking, oh boy, that was, you know, now it's like that's what they all are. And it is completely draining. And Steffi and I, you know, in the interest of time, I wanted to make sure that we had a chance to talk about compassion fatigue and the importance of self-care. That was a question that had come up a little while ago about self-care. There's some really good resources out there for that. First and foremost, it starts with you practicing all the things that you know are really good for you, for your health, for your mental health, your physical health. When you show up, you know, you're entering into the space, you're carrying a lot, and making sure that you take as little of it home with you as possible. I think that what Jennifer and I had talked about a couple weeks ago was my ask of NASW, besides this is awesome, but my ask is that when this is all over, that we really have an opportunity to do some healing activities, some real intentional, mindful, strategic ways of coming together to recover from the trauma of all of this. It's not normal what we're doing.
No.
We have to do that.
Good. I just wanted to add on to what Tracy was saying. None of what we are doing right now is normal. And, you know, having to have a family member meet their loved one in a parking lot before they are going to hospice is not normal. So the fact that you are feeling overwhelmed is, of course, completely understandable, and it's true. And I think if you're home, I think you said you were able to work from home and call families. I would take you have to allow for intentional breaks and intentional space in between your calls. So when you do a call and you are having this heavy dialogue and, you know, you feel exhausted, you need to step outside of your home. You need to go and get something to eat, get a drink of water, do a 5-minute meditation. We're giving you guys some resources that we've found that are all free to healthcare workers right now. So you need to do things to help yourself get through the non-normal of what this is right now. And it's hard. It's really, really hard. And I think because we think we're home too, that we need to show our worth by going. So how much am I documenting and doing? Because I don't want people to think I'm not doing enough. To still take a break. You need to set a half hour to eat a meal. You need to do those things that you would normally do because you have to preserve yourself. We have to take care of ourselves so we can keep having these conversations with the family members that we're working with. And especially if it's not the norm for you, you need to even make that a higher priority for that self-care. We do have some resources for some tips that might help with some of those conversations to kind of help the flow of it a little bit, to maybe make you feel a little bit less pressured. Of course, you're going to feel that level of pressure, but maybe take a little bit of that pressure off to help with some of your dialogue, because it's been proven and it's almost scripted in many ways, but you put your own touch on it. And you have to remember, you are doing the best you can in a completely abnormal situation. And you need to give yourself a break. You need to give yourself some grace, as Jennifer said earlier, and do what you need to do to center yourself and be okay, so you can make that next phone call and don't feel guilty about it. It's easy to say. It's not what we tell our patients, to not do something, but I'm telling you, don't feel guilty about it.
So specific, oh, I'm sorry, Jennifer.
Nope, go Tracy.
So specific to self-care, check out 10%.com, the Coronavirus Sanity Guide. You can check out headspace.com, COVID-19. Check out what your own agencies are offering. I know ours is offering, integrative medicine's offering meditation, Reiki. In our own little team, we're doing little touches here and there to help each other. Just a little example, our chaplain this morning started today off, because it's Holy Thursday, she washed our feet. We try to do like just as little something each day that keeps the human touch in what we're doing for ourselves and our good self-care. I want to point you to some other good resources as far as equipping you to quickly get up to speed on how to have a goals of care conversation. Stephanie and I were joking, like, how do you take years of a practice, and if you're asked to pack it in 5 minutes and send somebody on a plane, what do you give them? Well, one of the questions was, how do we get the resources? They will be shared with you at the end of this. Lots of good websites, and we tried to divide them up so that you'll have them, because we knew that there was no way we could do it justice in this, time frame. And quite frankly, we thought that talking was more important and expressing was more important than looking at a bunch of slides, but we prepared them so that you would have them. Okay?
Yep. We will send those out. So for everyone, I know there's been a lot of questions about the resources and information. We will send this out after the webinar today. Before we wrap up, it seems an hour flies by so quickly. We barely touched on all of the conversation and the questions that have come in. I just wanted to ask the group if this was helpful, and the next question would be, do we want to do more of these? We are happy to come together and to create this space for as long as it's needed. But I wanted to just hear, from the community. So if you could tell us on the sidebar if you think that's helpful, we would love to hear. I think that's the most important thing about NASW, making sure that we're supporting all the social workers in your variety of settings. Great, good to hear. So one of the other things that would be really helpful for us as a team at NASW is to hear from you after the fact about what other things you might need from us, whether it's continuing education tailored specifically to healthcare social workers right now. We do have our conference coming up, although our conference is a bit more general. You're all invited. It will be happening online. It's at the end of the month. But we'd love to hear from you about other topics you think that we should be talking about, other spaces that we should be addressing, needs of the community. So my invitation to you is for you to reach out and share with us so that we can continue to bring the resources that you need to the community for as long as we're going to be in this together.
Can I put a little plug in, Jen?
Of course.
Regarding the conference, for those of you who have always been interested and just love the topic, or those who this is a topic now new to you and you want to learn more, my colleague Julie DeSimone from the New Jersey Healthcare Quality Institute and I are presenting at the conference on Monday, the 27th, from 12 to 2. And our topic is called Advanced Care Planning, Normalizing and Fostering Meaningful End-of-Life Conversations in New Jersey. And of course, we're now going to have to add a few COVID-19 slides into our deck, because this was created before the pandemic. But that's actually the beauty of it, is this unfortunate circumstance. This has always been an important topic. And this is just highlighted now. This has put our topic in the sunlight. So anything we could do to help you think about creative ways to normalize this conversation into your practice setting, wherever that is, private practice, healthcare, or not. There's should be space for advanced care planning. It's a normal human activity to engage in advanced care planning. Nobody escapes end of life. So if I can help you in any way, we'd love to have you join us.
Thank you, Tracy. And I want to be mindful of everyone's time. I know that people have joined us on their lunch break. So we are going to close out for the day. Not to worry, for those of you who have typed some comments into the side, we see them, we're keeping track of them. After this, the slides will be made available to all the participants. This was recorded as well. So in the next 24 hours, you can certainly look for it on our NASW-NJ website, and it will be free for anyone who wants to watch it again, take away something, share it with a friend or a colleague. And then I would just invite you to make sure that you're following us on social media and our website. We are producing conversations like this. We have shared spaces for school social workers. We had one last week, very similar to this. We've been having virtual private practice conversations as well. And so the invitation is for you to connect with us, stay informed, join us for more of these conversations, and also peruse the community resources, because we're also doing a number of these types of things geared to the community at large, and just your mom, your sister, your friend, anybody who might need more tools, and just a space to understand what we're going through, which is trauma and grief and all sorts of things rolled into one. Stephanie and Tracy, thank you so much for joining us today and your willingness to jump in. Thank you all for joining us on this webinar from all over the country, and everyone stay healthy.
Yes, please.
Thank you for the opportunity.
Thank you so much.
Have a great day, everyone.